Chapter Diabetes mellitus 1. Introduction and Definition. Diabetes mellitus is a chronic metabolic disorder in which the production or function of the hormone insulin is impaired, leading to abnormally high blood glucose levels. Insulin, produced by the pancreas, helps transport glucose from food into the body's cells for energy production. When insulin is deficient or the body cannot use it properly, glucose accumulates in the blood, a condition known as hyperglycemia. According to the World Health Organization, over 500 million people worldwide currently suffer from diabetes, and the number is rapidly increasing. Especially in South Asia, lifestyle changes, dietary habits, weight gain, and lack of physical activity have contributed to a dramatic rise in diabetes cases. 2. Types of diabetes. Diabetes is mainly classified into 4 types. Type 1 diabetes, an autoimmune disease in which the immune system destroys the beta cells of the pancreas, results in complete lack of insulin production. Usually occurs in children and adolescents but can develop at any age. Patients require lifelong insulin injections. Type 2 diabetes, the most common form of diabetes. The body produces insulin but cannot use it effectively, insulin resistance, often caused by obesity, age, genetics, and unhealthy lifestyle habits. Initially controlled with oral medications, though insulin may eventually be required. Gestational diabetes develops during pregnancy due to hormonal changes that reduce insulin effectiveness. Typically resolves after childbirth but increases future risk of type 2 diabetes. Other rare types includes monogenic diabetes, secondary diabetes, etc. 4. Causes of diabetes. Genetic predisposition, higher risk if family members have diabetes, obesity and excess weight, especially fat accumulation around the waist, lack of physical activity, unhealthy diet, excess sugar, refined carbohydrates and fast food, stress and mental pressure, aging, hormonal changes during pregnancy, autoimmune reactions in type 1 diabetes. 5. Pathophysiology. Under normal conditions, glucose from food enters the bloodstream after digestion. Insulin helps transport this glucose into cells for energy production. In diabetes, insulin is insufficient or ineffective. Glucose cannot enter the cells. Blood glucose accumulates. Over time, high blood sugar damages blood vessels, nerves, kidneys, eyes, and the heart. 6. Signs and symptoms. 1. Excessive thirst or polydipsia. 2. Frequent urination or polyuria. 3. Increased hunger or polyphagia. 4. Sudden weight loss. 5. Fatigue and weakness. 6. Blurred vision. 7. Slow healing of wounds. 8. Numbness or tingling in hands and feet. Type 2 diabetes early stages may show no symptoms. Regular health checkups are essential. 7. Complications. Long-term uncontrolled diabetes may lead to heart disease and stroke, kidney disease, diabetic nephropathy, eye problems, diabetic retinopathy or glaucoma, nerve damage, neuropathy, foot ulcers and gangrene, skin infections. 8. Diagnosis. Fasting blood sugar, FBS, greater than or equal to 126 mg per deciliter, indicates diabetes. Random blood sugar, RBS, greater than or equal to 200 mg per deciliter, indicates diabetes. Oral glucose tolerance test, OGTT, greater than or equal to 200 mg per deciliter after 2 hours, indicates diabetes. HbA1c, greater than or equal to 6.5% indicates diabetes. 9. Treatment. Type 1. Lifelong insulin therapy, healthy diet and exercise. Type 2. Oral medications, metformin, sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors. Insulin if needed. Gestational diabetes. Dietary management, insulin if necessary. 10. Examples of medications. Metformin, 1 to 2 times daily after meals. Insulin, short or long acting, as per prescribed dose and schedule. Sulfonylureas, glycolazide, glimepiride, under medical supervision. Changing doses without medical advice is dangerous. 11. Lifestyle modifications. Regular exercise, at least 30 minutes of walking or running daily. Weight management, avoid sugar and fast food, drink adequate water, manage stress effectively. 12. Dietary planning. Plenty of vegetables, spinach, bottle gourd, bitter gourd, ridge gourd. Legumes and protein sources, fish, chicken, eggs, nuts. Low GI foods, brown rice, oats, vegetables. Fruits, orange, apple, guava, in moderation. 13. Home and natural remedies. Bitter gourd, fenugreek seeds, cinnamon, in moderation. Lemon juice in warm water on an empty stomach. Regular walking. 14. Prevention and awareness. Regular blood sugar testing. Special caution if there is a family history. Healthy diet and regular exercise. 15. Myths and facts. Diabetes is caused only by excessive sugar intake. Genetics, obesity and lifestyle all play roles. Diabetes can be cured by taking medicine for a few days. Diabetes is a lifelong manageable condition.
1. Global diabetes statistics. Diabetes is now a global health problem. According to the World Health Organization (WHO) 2024 data, approximately 537 million people worldwide suffer from diabetes, and this number is projected to reach 643 million by 2030. The International Diabetes Federation (IDF) reports that the prevalence of diabetes is rising rapidly in South Asia, particularly in Bangladesh, India, and Pakistan. In Bangladesh, around 13.5 million adults are affected, which is about 13% of the population. The prevalence is higher in urban areas, though rural regions are also seeing increasing trends. 2. History of diabetes. Diabetes has a history spanning several thousand years. Ancient Egyptian papyrus documents from 1500 BCE describe a disease characterized by excessive urination. Greek physician Aretius first used the term diabetes, meaning siphon, referring to water passing through the body. In 1921, Canadian scientists Frederick Banting and Charles Best discovered insulin, revolutionizing diabetes treatment. 3. Risk factors of diabetes. Genetic factors. Higher risk if diabetes exists in the family. Obesity. Fat accumulation around the waist is particularly risky. Physical inactivity. Lack of regular exercise. Unhealthy diet. Excess sugar, refined carbohydrates and fast food. Age. Risk increases after 40, though younger individuals are also affected. History of gestational diabetes. High blood pressure and cholesterol problems.
Classification and initial management of diabetes. Classification of diabetes. Diabetes can be broadly classified into 4 main types. Each type differs in characteristics, causes, impact on lifestyle, and treatment. Type 1 diabetes. This is an autoimmune disease where the beta cells of the pancreas are destroyed, stopping insulin production. It usually appears in childhood or adolescence. Patients require lifelong insulin therapy. Symptoms appear suddenly: excessive thirst, frequent urination, rapid weight loss. Type 2 diabetes. This is the most common form. Here, the body's cells cannot properly use insulin, or insulin production is insufficient. It is prevalent among adults and overweight individuals. Lifestyle changes, dietary control, and exercise are the primary treatments. Sometimes medications or insulin may be needed. Gestational diabetes. During pregnancy, hormonal changes cause difficulty in glucose control. Usually, blood sugar returns to normal after childbirth if proper diet and exercise are followed. However, there are risks for both mother and baby. Secondary diabetes occurs due to other illnesses or treatments, such as pancreatitis, long-term steroid use, or certain hormonal disorders. 0. Role and types of insulin in diabetes. Insulin is a crucial hormone that helps glucose enter the body's cells. In diabetes, insulin is deficient or less effective. Rapid acting, taken with meals. Onset 15 to 30 minutes, duration 3 to 5 hours. Short acting, onset 30 to 60 minutes, duration 5 to 8 hours. Intermediate acting, onset 1 to 2 hours, duration 12 to 18 hours. Long acting, slowly released into blood, lasts up to 24 hours. Administration, insulin pen or semi-automated injection device. Dose according to doctor's prescription. Regular blood glucose monitoring is essential. 0. Principles of nutrition therapy in diabetes. Diet planning is critical in diabetes. It should be based on calorie requirements, weight, age, and physical activity. Key principles: carbohydrate counting. Consume a specific amount daily. Low glycemic index foods: brown rice, oats, vegetables. Protein: meat, fish, lentils. Fats: limited from healthy sources, nuts, olive oil. Water: adequate hydration. Sample meal plan: breakfast, oats, eggs, vegetables. Lunch: brown rice, fish, lentils, salad. Dinner: whole wheat bread, chicken soup, vegetables. Snacks: nuts, orange, cucumber. 0. Diabetes and oral health. Diabetic patients are more prone to dental problems. Poor glucose control can lead to gum inflammation, tooth decay, oral infections, and fungal infections. Preventative measures: brush teeth twice a day. Regular dental checkups. Limit sugary foods. Seek prompt treatment for oral infections. 0. Eye complications in diabetes. Diabetic retinopathy. Diabetes can damage the retina. When blood vessels are affected, bleeding, swelling, and blurred vision occur. Stages: early, microaneurysms, minor bleeding. Progressive, formation of new blood vessels, visual decline. Advanced, blindness. Treatment: laser therapy, preserve damaged retina. Anti-VEGF injections prevent abnormal new blood vessel formation. Regular eye exams are essential.
6. Diabetes and kidney complications. Diabetic nephropathy. Diabetes can damage the kidneys over time. High blood sugar harms the tiny blood vessels in the kidneys, reducing their ability to function properly. In the early stages, patients may not show any symptoms, making regular testing essential. Early signs: presence of protein or albumin in urine, microalbuminuria, swelling in feet, hands, and face, high blood pressure. Treatment and prevention: maintaining proper blood sugar levels, controlling blood pressure with ACE inhibitors or ARBs, regular kidney function monitoring. Advanced stage: dialysis or artificial kidney transplant if the kidneys are severely damaged. 7. Diabetes and foot care or diabetic foot care. Diabetes increases the risk of foot infections and ulcers. Neuropathy and reduced blood circulation decrease sensation in the feet, allowing injuries to go unnoticed. Preventative measures: examine feet daily and seek treatment for wounds or blisters. Keep feet clean and dry. Wear comfortable and properly fitted shoes. Use antibiotics as prescribed for infections. Complications: untreated wounds can progress to gangrene. Sometimes amputation may be required. 8. Diabetes and hormonal relationships. Diabetes interacts with other hormones in the body. Thyroid disorders. Hormonal changes affect blood sugar control. Cortisol, or Cushing syndrome, increases blood sugar. PCOS, or polycystic ovary syndrome, increases the risk of type 2 diabetes in women. Prevention and management: regular hormonal tests, weight management and exercise, medication as advised by a doctor. 9. Modern technology in diabetes care. Technology plays a crucial role in diabetes management. Continuous glucose monitoring, or CGM, automatically monitors blood sugar levels. Insulin pump provides insulin automatically. Smart Insulin Pen helps track dosage. Mobile health apps assist in tracking diet, exercise, and blood sugar. Telemedicine enables remote consultation with healthcare providers. 10. Role of healthcare professionals in diabetes management. Managing diabetes requires a coordinated effort from the patient, family, and healthcare team. Healthcare team and their roles: doctor, diagnosis and prescription; nurse, insulin administration and wound care; dietitian, meal planning; psychologist, stress and anxiety management; pharmacist, ensuring proper medication usage. Daily activities: regular monitoring of blood pressure, blood sugar, and weight; educating the patient and family; prompt response in emergency situations. A team-based approach is essential to maintain the health of diabetes patients.
11. Diabetes in rural versus urban areas. The prevalence of diabetes differs between urban and rural areas. In urban areas, lifestyle, less physical activity, more sedentary; diet, fast food, high sugar, and processed foods; awareness, more regular checkups and medical consultations; result, higher prevalence of type 2 diabetes. In rural areas, lifestyle, more physical labor, active movement; diet, natural foods, fewer processed foods; awareness, less knowledge about the disease, less frequent testing; result, late diagnosis, higher risk of complications. Conclusion: health education and proper testing are essential in rural areas. 12. Economic impact. Diabetes imposes financial burdens on individuals, families, and the nation. Individual level: cost of medications and insulin, regular blood tests, specialist consultations, and hospital visits. Family level: increased cost if multiple members are affected, loss of income due to illness, increased stress within the family. National level: increased public health expenditure, loss of productivity in the workforce, long-term impact on health insurance and government health policies. 13. Diabetes Awareness Day and public health programs. World Diabetes Day, observed every year on November 14th. Purpose: raise awareness about diabetes, activities, free health screenings, educational seminars, and awareness campaigns. In Bangladesh, programs conducted by government and private hospitals, NGOs, and schools. Public health programs, training community health workers, diabetes screening camps, educational programs on diet and lifestyle management. 14. Diabetes and alternative therapies. Diabetes patients often turn to alternative therapies, different approaches, homeopathy, natural remedies based on individual symptoms, Ayurveda, use of herbs, spices, and lifestyle modifications, Unani, mild herbal remedies and lifestyle control. Debates. Scientific evidence for effectiveness is not confirmed in all cases. Use without a doctor's advice can be risky. Primary treatments, such as insulin or medications, should not be replaced. 15. Future prospects. Research in diabetes treatment is promising. Artificial pancreas. Automatically monitors blood sugar and administers insulin. Makes daily life easier and helps control blood sugar. Gene therapy. Restores beta cell function or improves insulin production, currently under clinical trials. Stem cell therapy. Regenerates damaged pancreatic cells. Normalizes insulin production. Conclusion. Future management of diabetes will be simpler. Advances in technology and research will improve patient quality of life. Public awareness and health education remain crucial. This chapter provides a comprehensive view of the social, economic, and future aspects of diabetes, along with prevention and technological management.